is that more and more people have become aware of fibroids in a largely negative context because there are complications which can occur as a result of the treatment of fibroids surgically. And when such complications arise, they, what gets the bad name is the fibroid, that oh, fibroid caused this, or they had this, and this resulted from fibroids. Whereas it was not the fibroids themselves that led to the unfortunate incident, it was the way in which it was handled. Yeah. So there's been a lot of awareness, both from the aspect of fertility as well. People who have been trying for several years, and then they go and see a doctor, and then they're told that they have fibroids. As fertility awareness has increased, so has also the awareness that fibroids can coexist with infertility.
Exactly. You mentioned something about fibroid getting its bad name from the way it's being managed. And I want to emphasize on it because the care of the condition matters. Now, when you mention those complications, you are referring to the underqualified, professionals, treating these conditions, correct?
Yes, absolutely. Now, fibroids, these are gynecological problems. They're very, very common. And a gynecologist, any gynecologist as part of your training would have been trained how to A, diagnose fibroids, and B, decide which fibroids need to be operated on, and 3, decide on the appropriate type of operation that needs to be done. Number 4, take adequate precautions to prevent complications, anticipate complications when you go for surgery. So, unfortunately, a lot of non-gynecologists have been getting involved with doing fibroid operations, as is the case with many other conditions in Nigeria. And unfortunately, some of them, when they do run into difficulties, through no fault of their own, but just because of the fact that they haven't actually been trained to do those kind of procedures. So the message really is that fibroids are not a condition that you should be scared about. The most important thing is to go to a qualified practitioner, a gynecologist, to have your diagnosis made, and also to give you a roadmap as to whether or not you need surgery. And for goodness sake, if you go to one gynecologist and you're not satisfied, go for a second opinion from another gynecologist.
Exactly.
Don't go to an alternative practitioner as your second opinion.
Exactly. You have to step it up, or stay at the same level of consultation.